Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then try to take actions to make a better system for all of us. Down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter that is the text for today's video. In it, you'll find links to medical research articles, news articles, and the actions that I'm going to recommend for you, together with a lot of resources that can help you in case you have a claim denied, or you need an abortion, or you want to get in touch with an organization that wants to promote universal health care. Anyway, let's get started. Let's start with good news, because we are inundated with bad news at the moment. So this is from Korea. Researchers at the Korean Advanced Institute of Science and Technology have developed a way to reprogram immune cells that are already inside tumors and turn them into cancer-killing machines. A drug that's injected directly into the tumor is absorbed by macrophages, prompting them to recognize and attack cancer cells while activating nearby immune defenses. This eliminates the need for lab-based cell extraction and modification. In animal models, the strategy significantly slowed tumor growth and sparked a strong anti-cancer immune response. You can find a link to their research report in the Healthcare Advocacy newsletter at in the American Cancer Society, the American Chemical Society, my apologies. American Chemical Society published their findings. In the U.S., we're having a problem with immigration and customs enforcement, and ICE is endangering the lives of all of us here. Renee Good was shot and killed by ICE agents while dropping her child off at school. A husband and wife were shot a day or so after that in Portland, Oregon, actually near where my wife and I live, by ICE agents. U.S. Immigration and Customs Enforcement agents were allowed inside a Minneapolis hospital for more than 24 hours, during which agents handcuffed a patient to a bed, and they didn't have a judicial warrant. They're not supposed to do anything without a judicial warrant. Look, haven't you had enough? I know I have. Congress has to vote before the end of January to keep funding the government. I want you to tell them not to fund ICE. Here's the action. Let's tell our congresspersons and senators we've had enough of ICE's brutal and murderous tactics on our street. They, in Congress, have the power to protect their constituents, and we need them to do that now. I'll put a link in the description box so you can call them if you want, but the easiest way is on your cell phone. Send a text message to 50409, that's ResistBot, and the message is sign, S-I-G-N, space, all caps, PCXWOL, sign PCXWOL to 50409. I'll read you the message. It'll go by email. If they ask you, select email. First, ICE needs to be abolished. They've always been notorious for brutal and undisciplined behavior, but that has escalated this week to an unacceptable level, and it's terrifying. Our rights are being trampled and people are being killed. Congress must get rid of ICE and replace it with an agency structured around lawful and non-political enforcement of our country's immigration laws. You have an opportunity to do this, as budget discussions will soon commence by zeroing the ICE budget. Finally, Donald Trump and his entire administration need to be impeached and removed. They're endangering our democracy and encouraging violence on citizens and flouting the Constitution. Thanks. Thank you for taking that action. The next one, let me talk about Trump's big bogus bill, because there's an effect that I think people haven't thought of. And it was, this was research done at the University of Chicago. The projected losses in Medicaid coverage as a result of President Trump's big, beautiful bill could result in more than 1 million missed cancer screenings and hundreds of avoidable deaths within 2 years of federal Medicaid eligibility restrictions taking effect, these researchers found. Using a decision analytical model based on state-level Medicaid data for adult enrollees, 7.5 million Medicaid-enrolled adults eligible for cancer screenings will lose coverage over the first 2 years of the implementation of the restrictions, resulting in 1,152,664 missed breast, colorectal, and lung cancer screenings. This was reported by Dr. Sarah Schubeck and Adrian Diaz, both at the University of Chicago. These are physicians that are doing this work. Anyway, those missed screenings will translate into 2,341 undetected cancers, with an excess of 326 cancers that will present at an advanced stage, and about 155 excess deaths they projected in their research letter that was published by the Journal of the American Medical Association Oncology. And you can find a link to their report in the newsletter. This is another attack by Trump and Republicans on healthcare, and the results are devastating. They're actually killing people by taking away Medicaid. Look, here's an extra credit action. Please take this. Call your congressperson and your senators and let them know that Trump's big bill and its cuts into Medicaid will result in over 1 million missed cancer screenings, resulting in more cancers and needless deaths. The link to call them will be in the newsletter, in the YouTube description box, but use my favorite way, ResistBot. You can text SIGN PYFNXB, that's all caps, PYF as in Frank, NXB, to 50409, and here's the email that you'll be sending. I'm your constituent, and I just found out that according to the University of Chicago, the Medicaid cuts enacted last year will result in over 1 million lost cancer screenings in the next 2 years, because over 7 million people will lose their health insurance. That will result in needless illness and preventable deaths. You can change it by restoring Medicaid as part of the upcoming budget negotiations. I'm sure you don't want constituents dying needlessly, do you? Below at the bottom of the email is a link to the medical report published in the Journal of the American Medical Association so that their legal analysts can read it. Thank you for watching this. Please take the actions. Down below you can send me comments or suggestions for stories. Send them here or to healthcareadvocacy1@gmail.com. Down below you can also like, share, and subscribe. Thank you. Bye-bye.